Because of screening, colorectal cancer is actually decreased in the general population. However, in certain age groups, it's been on the rise. And in fact, in the youngest age groups, patients that are diagnosed between the age of 20 to 49, we see that over the last almost 20 years, colorectal cancer has risen about 1.5% per year for that 20-year period. And we don't really know why. The interesting thing that our group has found is by looking at the National SEER database, which is surveillance, epidemiology, and end results. It's a large cancer database, is that we found out that these tumors are different. They're characterized slightly different. They tend to be more aggressive in younger patients. It tends to be more rectal and left-sided as opposed to right-sided tumors. And for these younger patients, they actually are presenting with later and more aggressive disease, which is very concerning. It kind of lets us know that we need to strongly figure out who are the patients most at risk. That's what some of our work is doing, is trying to figure out. We know that patients should, if they have a family history for colorectal cancer, be screened earlier than 50. Now we're actually trying to look at the some genomic analysis and try and understand if there are genetic differences, because if there are genetic differences, then those genes can be targeted, and we might have a potential way to pick up earlier cancers or fight earlier cancers in a more personalized way. We really are on the cutting edge of science. We know those patients that are at higher risk. We know who we can counsel and who we should send for earlier screening. And so I think that by coming to a facility, you not only get that kind of higher level of care, but you also, by working with your physicians, you help improve care for others.